Well, as healthcare becomes increasingly strained due to the numbers of people falling ill from COVID-19, where does that leave the most vulnerable in the pandemic, which is the elderly? Mia Malan is the Bhekisisa Center for Health Journalism's editor. She joins me now for more on this story. Mia, good evening. It's always a pleasure in his weekly newsletter on Monday, touching on why the elderly are such a vulnerable group. Speak to us more about that.
So when there's competition for life-saving equipment such as ventilators or other forms of oxygen therapy, health workers often argue that the patients with the best life expectancy and chance of survival should be prioritized. In our story today at Bhekisisa, we included an example of a woman in the Democratic Republic of the Congo who took her grandfather to a hospital in Kinshasa where he was put on a ventilator. He had COVID-related breathing problems, and a younger patient then arrived and he was taken off the ventilator to give priority to the younger patient because the hospital only had 3 ventilators, and he then died minutes later. And the organization that reported this information, HelpAge, reports that this also happens in many other countries where they are based, for instance, India and Bangladesh, where older people are often seen as dispensable and refuse treatment.
It's interesting because in South Africa, this conversation has been taking place for some time over how do we prioritize those very limited resources, especially when it comes to the moment where our health services and our hospitals are overcapacitated. Do you think there have been clear policy guidelines in terms of what needs to happen so that some people are not disadvantaged over others?
South Africa does have clear guidelines from the South African Medical Association as well. We are busy with a follow-up story on that, so I am not clear on all the details right now. But what I can say in terms of social grants, in May, President Ramaphosa, as you may recall, announced that old age grants would be increased by 250 rands per month for the next 6 months. And that increased the grant to just over 2,000 rands. But what we're dealing with is that we know in our country that many older people support grandchildren. And during lockdown, schools were closed, so they had those grandchildren for longer at home, and there were more expenses. But the grant wasn't increased equally for them to be able to cover those expenses. And one of the criticisms of the government's implementation of our lockdown is that the safety nets, such as increased grants or food parcels, were not in place to help families who would lose their income during lockdown or have increased expenses. So the lockdown started before those safety nets were in place, and undoubtedly many older people who were part of families suffered as a result of that.
Is this discrimination against the elderly, is it effectively what's happening here?
I have not seen specific incidences of that, but it has happened in the past with other illnesses. We've also heard many reports, for instance, in old age homes of abuse. And if we just look at the result of lockdown, for instance, if you don't have money, if you're an older person and you can't sustain yourself, you often go and stay with a family to be able to be helped. And we've heard of many reports, not just in South Africa, but also in other countries, where that often results in abuse because the older people are then seen as a burden for the family. We, for instance, reported on one example in India where an older person who was a teacher at a private school couldn't work during lockdown and didn't get a salary, and then went to stay with a family and had to lose a lot of weight because her food was rationed because she couldn't contribute financially to food at the family.
Well, it's an absolutely sad situation, and it's good that organizations like HelpAge are bringing it to the eye and the attention of the world. Mia Malan, the editor-in-chief at the Bhekisisa Center for Health Journalism.